I think Jabindra and Ashok have given a very good overview and actually coming from a very experiential level. But I'll still start with what we have, just so that we can start the conversation. Um, yeah, it's in slide mode now. Yeah.
Yes.
Okay, so what is the theory of change? Like Javindra also said earlier, we all, in most of the programs and the work we do, especially in the social movements, but also the development work that happens, it is always, it is desirable to have a certain theory of change. We all have an idea of where we want to go, what is it that we want to achieve, what is the change we want to bring. And we also have activities planned or interventions planned on how we are going to bring about this change. So I think then theory of change is like an articulation, is a more systematic way of thinking and articulating of how our planned intervention or how our planned activities are going to bring about the change that we desire. So it can, I think Jabindra very nicely put light on that. It can be a two-line for an organization. It can be a two-line, a theory of change can be a two-line thing to explain how it is, or it can be a very complex model, a logical framework, etc., to articulate, an organization's theory of change. And it really depends how one wants to go about it. Next, yeah. So the definition would be a theory of change is a method that explains how a given intervention or set of interventions is expected to lead to the changes that we want. The next few slides. So this is just, we wanted to give an overview of why have we dedicated an entire session to, something called theory of change. So that's about it. Next few slides will focus on PHM's theory of change. What is this movement's theory of change? I'll start with the foundational document. It's the foundational document that we have, the PHM's Charter for Health, which is also provided in your readings, which sort of guides us to what is the vision that this movement has. Before that, a little bit about PHM. The movement was formed in 2000. It's a global network. It brings together grassroots organizations, civil society groups, individuals, professionals, academics. The only requirement for you is to have read and agree to the People's Charter of Health, which we will discuss in the following slides. The movement has presence in different degrees in about 70 countries. In some countries, it's very strong. So, for example, in India, there are different state or provinces have their own chapters. In some other countries, it'll be, one organization that coordinates the PHM work, or few individuals who coordinate PHM work, and so on. As I said earlier, the movement is guided by the People's Charter for Health, which expresses PHM's values, visions, and goals. So what is the vision? I'll spend 2 minutes on this. Equity. Equity, basically, it has the values of fairness and justice underlining it. Equity, ecologically sustainable development, as a development that cares for the environment, which is not driven by the ethos of greed or profit making or overconsumption. And peace are at the heart of our vision of a better world, a world in which a healthy life for all is a reality, a world that respects, appreciates, and celebrates all life and diversity, and also knowledges, different forms of knowledges that different communities across the world have. a world that enables the flowering of people's talents and abilities to enrich each other, and a world in which people's voices guide the decisions that shape our lives. People's voices, as opposed to voices of corporations or voices of rich countries, and so on. This is, okay, next slide. Yeah. So this charter was adopted at the People's Health Assembly in 2000. This was the first People's Health Assembly where about 1,500 people from across the world came together for a common demand for health for all. The statement said it is now essential to build a concerted international effort to put the goal of health for all in its rightful place on the development agenda. Genuine people-centered initiatives must be strengthened to increase pressure on decision makers, governments, and the private sector to ensure that the vision of Alma Ata becomes a reality. The movement also came together because in 1978, the Alma Ata document was found, and it's a foundational document for PHM. And the document talked about achieving health for all by the year 2000. And that had not happened by the year 2000. And that was one way for organizations to come together and say that this has not happened, and what is it that we need to do to make health for all a reality. I think these points are important just to underline the basic values in the charter, but generally also for PHM, how health is a human right. Human right, which basically means it's a legal obligation for governments to provide to their people, which governments or states are obliged to provide legally. The principles of universal, it should be available to everybody regardless of their race, ethnicity, gender, etc. Comprehensive, meaning a holistic approach covering a range of services, not just health services, different services, and the values of primary healthcare, which talk about intersectoral convergence, which talk about community participation, which talk about social justice, etc. So the principles of universal, comprehensive, and primary healthcare should be the basis for formulating policies related to health at different levels, provincial, national, state, internationally. The participation of people, if you see, this keeps coming again and again, having people's voice in decision making, having their genuine participation and not just formal participation over deciding the health agenda and health policies. So participation of people and people's organization that represent them is essential. Health is primarily determined by the political, economic, social, and physical environment. So this I've already talked about. The charter talked about the failure to implement the original vision of Alma Ata, and hence the need for organizations to come together. Okay. Yeah. If you see the charter, after all the values have after a discussion about the principles and the values and the problem, it has a call for action, which again in a way repeats most of the things that we talk about, but also how we are going to achieve it. The call to action starts with, to combat the global health crisis, we need to take action at all levels, individual, community, national, regional, and global, and in all sectors, not just health sector. That is again that's something very important to PHM, of how different sectors determine the health of the people. So I'm not going to spend more time. It talks again of health as a human right, which we discussed earlier. It talks about people's participation in health, in deciding their health. It talks about the broader determinants of health: economic, social, political, environmental, war, and conflict. If there's a war ongoing in any country, the health of its people is not going to be good. So there's an emphasis on these broader determinants. This is David's photo in one of the campaigns. Here we are quoting Dr. Habdan Maler. You must be knowing him from our previous assignment. He was one of the WHO DG, and his testimony for people's health movement and the comprehensive vision that it has for health as opposed to many other organizations and groups. So, what is PHM's theory of change? And how basically how are we planning to bring about the change that we are talking about? So one way to look at it is through this slide. And like we said earlier, it depends how complex and how elaborate one wants to make it. So one way to look at it is through this. We have 5 main social movement strategy. One is movement building and networking, which talks about recruiting younger health activists in the movement, raising funds for key activities of the movement, partnering with the organizations that think alike, or coming together to achieve common agenda or against common enemies, and so on. Campaign and advocacy, which talks about direct action. So recently, South Africa held a protest in front of Parliament. PHM South Africa held a protest against South African Parliament to oppose rising food prices. So that would be one example of campaigning and advocacy. Capacity building so this course, IPHU course that we are having, is an example of capacity building of both individuals, but also organizations, and increasing not just the knowledge, but also skills and confidence and networking skills, etc. The fourth social movement strategy would be to build new knowledge through a critical lens. So let's say if end of this course, the group decides to come together and work on one common theme and look at it critically and publish a booklet on it, that would be one example of knowledge development. And in the end would be engaging with global governance, which is also the theme of this course. So for example, the WHO Watch that we do is one example of intervening, monitoring, tracking what is happening at the global level, not just WHO, but also what policies is the World Bank pushing, what is happening at the World Trade Organizations, and so on. And corresponding to these, we have different 5 PHM programs to systemize this as we work. Yeah, this is another way to look at PHM's theory of change. David shared this with us. The macro-micro principle, taking action at the local level is as important as taking action at the global regional level. And both need to feed into each other and reflect and learn from each other. Direct cultural action, living differently through different ethos and values such as through sharing and love and justice and solidarity and so on. Political advocacy, which we all have been doing at some level or other with our governments and at different levels. Working with community directly, which has already been shared. Working through the principles of primary health care. Some of working with the community is one important aspect of that. And in the end, working towards a convergence of social and political movements. So not just working in isolation, but also building alliances with different organizations who share the same values. Yeah, so that's the so this is a photo from the first People's Health Assembly, which I shared earlier. About 1,500 activists came together in Gano Shastra Kendra in Dhaka in 2000, and that is where the People's Charter for Health was adopted. Then we have next few assemblies in Ecuador, South Africa, Bangladesh again. The most recent one was in Mar del Plata in Argentina in April. Um, yeah, and that's where one of your readings came from, the call to action, the readings that we had given. That is where that reading was drafted in consultation with different PHM circles and adopted. Just to end, Anneleen will take over from here, but just to end here, I mean, why are we studying this? And especially why are we studying PHM's theory of change? I think the idea is for all of us to reflect what is the theory of change that we use in our work. Are there any strategies or actions or interventions which you just saw in this presentation that can be used in your own work? And also, why these particular strategies and why not others? Because even, let's say, a charitable organization based in Global North, working in the South, it also has its own theory of change. But why don't we, but how is that theory of change? How would that theory of change be different from what PHM has? So I think this is for you to reflect on some of these questions. Yeah, Anneleen.
Thank you, Deepika. And thank you for giving such a clear overview also of theory of change. And I think to really take away this idea that, or for PHM, you've got the Alma Ata principles. And as you could see, a lot of these Alma Ata principles are perfectly reflected in our call to action. So really to keep the vision we have is not a vision we just invented. This is a very broad kind of endorsed vision of how to achieve health for all. So I'm going to continue sharing. We might have to go through a few slides just moving forward to here. So the idea was for me to take you a bit more in depth through the different kind of programs that PHM has to achieve its vision. So Deepika gave the slide with these two columns, which has kind of strategies and then programs. And we're going to go through each of the programs that were on the right side of that slide and discuss a little bit how they fit in the theory of change. So first of all, one of the main programs of PHM is a Health for All campaign. And this campaign speaks through to the strategy of movement building and campaigning. So it's really about linking local action with regional and global initiatives. So it's not kind of a top-down organized campaign whereby at global level campaign details are decided and then locally we implement it. No, it's really a campaign that aims to embrace every initiative that is taken towards health for all is included. So we try to kind of collate them in different themes. There's different thematic groups within PHM, but really any local campaign that aims for health for all can subscribe to the Health for All campaign because all of it is part of a movement pushing for this vision. So there's different thematic circles, which anybody is very welcome to be part of it. They meet regularly and discuss local campaigns, regional interlinkages, global issues that they jointly want to tackle. There's a gender justice campaign, the environment and ecosystem campaign, nutrition and food campaign, the trade and health, equitable health systems, and war and conflict. So basically, most of what we do in the movement falls under each of them. But that doesn't mean that when we act locally, it necessarily is part of one of these thematic groups. Like within PHM South Africa, we do a lot of action on food and nutrition, but we sometimes also not always are part of the food and nutrition circle. So it's a possibility for regional collaboration. It's not a necessity. It's a channel that is offered at global level. So the idea is really to encourage moving from local activity to regional collaboration. It's emphasizing research on issues. So through these circles, we also work with other programs. For example, when we speak about the WHO tracker, we've spoken about that. A lot of the commentaries are prepared through these thematic circles, because some of the agenda topics of the WHO, they speak on nutrition and food sovereignty or on health systems. So the people who are part of this circle then also have an ability to give the input on the commentaries that are part of the tracker that then will be used for advocacy at the WHO or locally. So that's how the programs also intertwined and support each other. One of the major campaign focuses of Health for All campaign is no to privatization of healthcare. And this goes across, like if we think of food and nutrition, it's against the privatization or corporatization of food. If we think about public pharmacy, it's around the privatization of production of health technologies. If we think about universal health coverage, UHC, a lot of our criticism is also how it enhances privatization of healthcare. So there's this kind of common denominator with a big focus on campaigning against privatization. Then if we look at the more recent and current global campaigns, there's two campaigns I would like to highlight just as an example of more global driven campaigns. So I spoke before about how each country action is part of this movement for health for all and falls under the campaign, but there's also some campaigns that are starting a bit more at a global level. One of them is the campaign to donate for the hospital that has been, completely destroyed during the war in Gaza. And I think most of you have heard of that campaign. So while it's a campaign to donate for this hospital, it's also a campaign where we share any kind of action that we undertake and support to our comrades in Gaza, in order to create a strong narrative that there is a lot of civil society action and a lot of people opposing the genocide there. A second global campaign is one on public pharma. So I mentioned before this word public pharma when I spoke about how a lot of what we do at PHM is fighting privatization. Within public pharma, it's the same, but it goes further. So our public pharma campaign is mainly located in Brazil and Europe. But from next year, we hope to include other regions and other country circles that are interested in pushing forward to protect, to establish, or to advance public pharma. So if anybody would be interested in that, to be part of that within your region, you would be very welcome to join that kind of campaign as well. Next slide. So then I would like to speak about another program of PHM. So we spoke about Health for All campaign. I would like to speak a bit about the Democratizing Global Health Governance campaign. And even though one could think that this speaks to the one strategic principle of addressing global health governance, I find this one of the programs that really cross-cuts a lot of the different strategies within the theory of change of PHM. Because a big focus is also on capacity building. During the watch, a lot of young health activists come together and they really get their head around the agenda of the WHO. They really get their head around the different topics and how to comment, how to analyze them. So there's a lot of capacity building in this kind of program. There's also the development of knowledge and the dissemination of knowledge. Commentaries are being prepared, shared across the movement, discussed, knowledge gets disseminated. It's also around engaging with global health governance, of course, and it has a very strong advocacy component as well. So not only in Geneva are the watchers going around and trying to speak to the delegates that are walking in the hallways of the building in Geneva, but also we try to, at country level and at regional level, to engage with delegates beforehand. And we did it especially around the pandemic treaty, like within South Africa, we really engaged with our health minister, we engaged with the missions in Geneva with our stance, and we got some really good feedback and interaction to the point that they wanted to know what our opinion was so that they could speak with some kind of more endorsed voice. So it wasn't them as a mission, but they could say they consulted with civil society within the country, and this is actually what they want to say. So that program really brings together a lot of the kind of strategies of PHM. It also includes a lot of networking and collaboration with other global actors, and you can see them listed on the screens as Medicus Mundi, Third World Network, Medico International, because one of the theories of change is also this kind of building a global network. One of the Health for All campaign is a lot also around local action and building networks thematically. The global health governance component or activity of PHM, the program, is then building networks around global health governance. And this slide shows very clearly how we build these partnerships and collaborations and how they extend also beyond the topics. For example, in the bottom right, you can see the People's Health Dispatch, which is a very nice publication that PHM works with. It's an opportunity for all of us when we have something to write, when we have an analysis of a situation in a country, when we want to expose a campaign, we can contact the People's Health Dispatch and they will happily publish for us. There's other types of publications that we're involved with. And you can see many different versions. So part of the movement, some things also cross-cut different programs, and publications is definitely one of that. We spoke about the tracker. I'm not going to spend too much time on it, but again, this is a way of building capacity, a way of disseminating knowledge, of building knowledge, and it is an advocacy tool. So a lot of these programs really speak to many different strategies within PHM. Then the International People's Health University is another program of PHM that we're all part of it today. This one is like the core capacity building program, and more than 30 IPHUs have taken place since 2005. I think David Lake, who's here, is actually one of the founders of the university and been part of almost all of them. So if you have any questions about the IPHU, we should direct them at David. And initially they were more global, was really bringing health activists from across the globe together. And this created such a space for inspiration and learning. Even though it focused on the politics of health, there was a lot of learning in the corridors of being together. And I feel that a lot of the movement got built through these IPHUs as well, networks being formed, relationships being built. So it's an incredible program that then also leads to advocacy, because the IPHUs have always been very action orientated. So while the first part was analysis and building capacity amongst ourselves around the politics of health, a big part of the IPHU was now, how do we going to practically use this information to create change? What are the actions we can take locally or regionally or globally to affect the change that we want to see? So it's a great space. Then I think the last program I'll speak about is the Global Health Watch, which is one of the flagship publications of PHM, and you can see we've got 6 of them. It's an alternative health report. It really analyzes health and global health from the perspective of PHM. It's a critical analysis. It's so worth reading it for anybody in the field of public health to get an, I almost want to say, hopeful narrative. Maybe it's not always hopeful, but a lot of the writing also includes alternatives. And I think that's quite important. So it's research, analysis, watching what's happening, and then also what are the alternatives? What can we do? What has been happening to tackle these issues? So as it says at the bottom, it's a platform of resistance to the neoliberal dominance in public health theory and policy discourse. It's really worthwhile reading, and it's freely available on PHM's website. We've also tried to add more popular language to the Global Health Watch. So I think of the last Global Health Watch, there's cartoons available that give the essence of what is being analyzed and researched in the Global Health Watch in a more accessible language when we try to build a movement locally. So I just added this slide again to just remind us and to see how we really spoke about all these different strategies throughout the different programs of PHM. We spoke about movement building, campaigning, capacity building, knowledge development, engaging with global health governance. And we also saw how each of these programs really addresses different aspects of the theory of change in one go. I think that leaves us to see if there's any questions and comments on the presentations about PHM's theory of change. So I'm opening it to the floor for now for maybe 5 minutes, if we can just be brief, and then we'll slowly move